It's probably there now. It says preparing to live stream.
Welcome everybody to another Holistic Vet Sisters. Here we are at 6 o'clock on a Thursday for you. And there's 4 of us this week. We've got a new sister with us, Bella, and Dr. Tina is still with us, and Dr. Lise, and and myself. And so Bella, we want to hear all about Bella's story, how she got involved in nutrition really as a vet, because as you know, the majority of the mainstream vets aren't really looking at nutrition in great detail. So to have a vet who calls themselves the nutrition vet is actually quite unique, I think. Hi, Bella.
Hello, Caroline. Thank you so much for the invitation. I've been looking forward to doing this.
That's okay. No, we've been looking forward to having you on. I met you at the Natural Dog Expo this year.
Yep.
Which was brilliant. Yeah, such a good community, and I'm really, really pleased you can be part of that as well.
It was very, very uplifting being around like-minded people, because it's quite an uphill battle when you're in mainstream practice. But the place I'm at now, I'm much more open-minded than many places I've worked in the past, because I think the knowledge is getting there much more into the mainstream, thanks to our human medics, and now the veterinary side too.
Well, this is it, isn't it? I mean, even doctors in mainstream medicine for us will talk about things like 5 a day, and they'll encourage us to eat less processed food and more fresh food. Yeah. Yet it doesn't seem to correlate with vets, does it?
We're lagging behind, I think. But just to tell you a bit about my background story, I was a mature age student for veterinary science, and was very fortunate to get into Sydney University, where I was living at the time. And I had always, even from the moment I got a dog as an adult, interested in fresh feeding, because I think having had family who've always done it is a huge influence when you're growing up. And people were always in my family quite rude about what they call bulls. Just to drag food.
Is that the kibble?
Yes, it was. That was my grandmother being outrageous. But yeah, so I think it obviously influences you. But also I was very fortunate in being given fresh food as a child. There weren't those ultra-processed foods in such great number that there are these days. And it was much easier then, I think, to eat better, probably, even though you ate a lot more simply than you would nowadays, with lots of chefs with lots of complex ingredients making incredible foods. But it worked. It was good food, and kept us pretty healthy on the whole. But there were also lots of things like vaccinations weren't such a big thing as well. So that's going back a fair bit for people of today, probably. But at Sydney University, went through vet school there. And in my very, very first job in Australia, at Hornsby Heights veterinary practice, they were raw food feeders, which was quite unusual. And they were very influenced by Dr. Ian Billinghurst, who's an Australian vet, who must be in his 70s now, I think. But he wrote one of the first major books from the vets, called Give a Dog a Bone. And I was very interested to read that, because it just made such perfect sense. No doubt we've all got a copy, have we?
Yeah, absolutely.
And we had these massive freezers in the waiting room full of the BARF diet, which came in these sort of hamburger type shapes, and about yay long, and about 10 hamburger patties made by Ian Billinghurst's company of raw food, which had bits of chewed up bone in there. It was brilliant food. And it was really nice to see that we could do that right from the veterinary practice, rather than having to send people off to another place. There was no such thing as delivery on those days. But yeah, on the whole, that was the first job I ever had. And I must say that a lot of the pets that had allergies in particular, if we could encourage people to feed them, they would do really, really well. So I guess that was my start in life in the veterinary industry. I was very fortunate, I think.
But you are in the UK now. You're practicing in the UK, and you even offer online consults, I think, don't you?
I do. I've now that I've been in practice about 23 years, I want to really accelerate the nutrition side of things, because I do this all day, every day, talking to people about their diseased pets and how they can help through food, because I feel negligent if I don't mention it and don't ask what's already being fed, because so many ultra processed foods are being fed that people aren't aware of, or they're very processed and it says natural on the packet, for instance. An example would be rabbit's ears, and they come from overseas. They've been sprayed within an inch of their life so they don't go off, which is, you know, what has to happen. But people are misled into thinking that they've just, you know, been, they've had a gentle breeze and have been hanging up and been air dried in the UK, which has been so far from the truth. And it affects the guts of these animals, and they don't do well, even though they might be on fairly good food anyway. The other thing I really wanted to help in, because I'm in mainstream practice, is a lot of people we all have budget and lifestyle restrictions. It's quite humbling being a vet, because you see such different sides of humanity, such appalling suffering, and difficulties that people go through. I think anybody who deals with public or lots of different people all the time, you know, I might see 20, 30 people a day coming through, unless I'm on an operations day, in which case that's a bit of a rest from having to talk to people. But, you know, people really do their best. And the fact they walked in your door is quite something, because they've made that commitment already. So whatever choice they have, you work with the best you can with what their beliefs and their budget and their lifestyle happens to be. So I don't know if you've got somebody looking after elderly parents with dementia or Alzheimer's, that's really tough. And you've got to be practical, because those elderly people will not remember the dog's not been fed or the cat has an allergy to something. So I'm particularly interested in trying to get colleagues to just realize that you can't always get everybody to feed that lovely organic, fresh, local sourced food. It isn't going to work for everybody. Of course, I wish everybody could, but that would be a utopian vision.
I think that's such a beautiful point to make. And also just the concept that it's not about feeding discount supermarket kibble or feeding the most beautiful naturally reared, you know, organic raw. There's a whole spectrum in between, and I think it's called nudging in human behavior. When you just do, you know, one little thing, makes it easier to do one little thing. Like if you feed kibble, add something to the kibble, or change the brand, or, you know, there's a million things that you can do. But I think we're all often inhibited by the idea that I can't do it perfectly, so I'm not even going to try. So I think that's, you know, thank you for making that point. I think that's a really important point to make.
That's quite okay. And I think they say perfection is the enemy of good, and never a truer word. But you're right about the nudging, and it's not a deliberate thing. But I have worked, I mean, when you've worked in business long enough, you sort of find out what works to help people through and get to be empowering them with the knowledge they need to make a better change. You've got to give them the knowledge as to why they need to do it, and they can go and think about it and work out what's best. And I'll often write down options for people, say, well, you could try the fresh food, or you could home cook, or you could do the canned, or you could do this freeze-dried food. You could just maybe just go grain-free to start with, and then you can add supplements. So there's lots of different approaches, as you were saying, Lise. Which will help people. And I often see that when people have found an improvement, they're keen to do more. And that's very rewarding.
That's very true as well.
You trained and worked in practice mainstream, or have you always worked in this more sort of open-minded way for nutrition?
I think probably that's always been at the background of what I've done, but it's come much more to the forefront in the last 10 years, probably because it's been so fantastic, all the podcasts and online information out there. It's been so educational, and it's incredible how much you can do yourself to find out more. I'm not a huge social media user, so I don't just get sound bites. I go quite deep on the long form podcasts. And I find that actually is much, much more informative. And I have to know the detail. I can't just listen to a phrase and go, great, I'll do that. And I know some people, they admit themselves that's their lifestyle, and that's the way they work. They're usually younger than me. But I guess, should we talk about leaky gut syndrome now? Because that seems to underpin so much, and there's so much more known about that. I think Professor Tim Spector of King's College in London has been the leading light for the human side of this. He had the Zoe app in COVID times. What a dreadful episode that has been. But he started an app where everybody put their symptoms on this app, the Zoe app, and then he collated all these thousands of information and data and presented it to government so that they could give the proper advice rather than just anything with monetary interests, to make sure that people could do the best they can in the medical field. He has since then got a nutrition app, and he's testing the gut microbiome. He's testing fat metabolism and glucose metabolism through quite a structured program. And he also is now sort of providing supplements and has a podcast himself for the human side of this. And I think what I like particularly about Professor Tim Spector is that he has broken sort of myths that have been, and actually succeeded in persuading people, for instance, that genes aren't always set in stone, because he did the identical twin study, for instance, and he followed these genes of these twins through life and found that they changed depending on lifestyle. So I think that's really powerful. And we know that, therefore, okay, you've got a bulldog and it might have ammonium urate, but hey, what about the lifestyle and the food? I reckon that's incredibly powerful, and we can make a change there. So leaky gut syndrome, going back to that, that's very much on his website and his information blogs and things, because it's really, there are 3 ways you can enter the body if you're a toxin or a chemical or a food, or anything really. There's the skin, there's the lungs or the respiratory tract, and the gut. So there are only those ways that things can get into our body to affect it. And the gut, I would argue, is probably the most impactful and the easiest to sort out and make a change and a difference. So leaky gut. If you are a smoker, I'm going to give an example here, which is to do with lungs, which seems a bit odd. If you're a smoker, over time, your lungs are going to start to get quite unhappy, because the chemicals in the cigarette are going to change the lining of your lungs and your cells, and therefore your lungs won't work as well. If you eat a lot of ultra-processed food and you keep bombarding your gut with things in the ultra-processed food, which are chemicals and additives and things that aren't normally found in fresh food, it does harm the gut lining. And that can be hugely impactful, because we have discovered that the gut has the biggest immune system, the biggest brain, after probably the biggest brain of all, actually. And it's all done through your trillions of microbes. And your microbes consist of bacteria, viruses, protozoa, probably some intestinal worms, and other critters that we haven't even probably discovered yet. But I think the latest estimate was there are over 1 trillion microbes in our gut, and they all do a job. So good luck AI in sorting that out anytime soon, I would suggest. But I think when you realize that, if you get an upset gut microbiome, then you really do struggle with your life generally, with your health. So in the human field, there are many studies that have shown that if you've got leaky gut because of this bombardment and this effect on your gut lining, what will happen is your lovely cells will start to shrivel. They'll get shorter. They're meant to have lots of surface area for absorption, and that gets very, very blunted, called the villi. You also have cells which are joined together with a very good fortress-like gate called the tight junctions, and these get loose because they've been hammered and rammed so much with all the incorrect things coming through that they start to open and have just a chink where things can over time get through. So you're not going to see vomiting, you're not going to see diarrhea, but over time these critters will get or different things will get through that should not have got through. I was listening to something today and they were talking about food sensitivities to broccoli. And the reason for that is because of the hyperpermeable gut. The faulty gut is allowing components of broccoli to get through that shouldn't have been presented in that way. It should have been broken down into its component parts, and it hasn't been. So a sensitivity has developed. Now, the argument, which I completely agree with, is once you heal the gut, broccoli is no longer a problem. It was what was going through that was the problem. And we find this with any food type. So often I'll get people in my clinic saying, oh, he's allergic to this, that, and the other. But I would question whether they're allergic or actually have they built a sensitivity because of the faulty gut, and it actually can be reversed. And I think it's incredibly exciting and hopeful. And I do often find that with my approach, I can get people to start slow and turn the situation around. Because ultimately, with our gut microbiome, it needs to be very, very diverse to give us the healthiest sort of health span, I'd like to call it, actually, the healthiest health span that we can acquire. No good living a long time if you feel horrible. Yeah, I think as far as leaky gut goes, I was going to mention about the human diseases it's been found to result in, and that includes organs, I think, which I'll mention. There's the pancreas, the kidney, the liver, the brain, the lungs. I mean, I don't think there's probably a body part it won't affect, because if you can understand the mechanism as to what's happening and setting up this incredible inflammatory situation, and the immune system goes awry because it doesn't recognize what's coming through and it has a bit of a panic attack and goes rushing around, causing inflammation, gobbling up things that it shouldn't, and then saying broccoli is obviously something to worry about. Then things are not going to go well. And they've even said things like Alzheimer's, depression, bipolar, so many, pancreatitis, glomerulonephritis, which is a kidney inflammatory process. Anything with an itis is inflammation, by the way. And I think that honestly, leaky gut is a huge part of that. All right.
I think what you were saying about the symptoms not showing immediately is really, really important for the guardian to understand, because people say, oh, my dog's fine, or my dog's always been fine, until suddenly there was XYZ happening. And actually it can be that for years, very slowly, the gut's been getting more inflamed, more permeable, and degrading in this way, and then you suddenly see the symptoms, because the body just is so clever. It just heals itself, it tries to heal, and then when it gets to the point it just can't do it anymore, that's when we see the symptoms, and we say, oh, must have been what he ate yesterday, or maybe it was what happened at the weekend. And it's been going on for so long internally,
I think
sorry, Tina, go ahead.
I was just, this is such a frustrating area for me, because I get so frustrated in practice. You see these dogs, usually it starts with, it's licking his paws, and then they start, even in the practice, just like shaving, giving creams, giving foams, and they just overlook everything. And this happens everywhere in every clinic, and it gets worse. And they keep giving more and more anti-itch medication until they're on 3 different types, and they end up with cancer within a few years. And it's like never talked about the diet. And if it is, it's like, oh, try a different diet. Yeah, it worked for like a few weeks, and then he started itching again because they develop a new allergy, because the holes are still there. You're just changing the proteins, and it's such a frustrating area that nobody understands. And there's so much we could do with just like diet and food and lifestyle, and it's so frustrating.
You know, though, with it being, see, for me, it's like, I actually do think that has some mechanistic understanding. I know we want to move away from that way of thinking, but for me, with it happening, actually the cells are changing, and we can consider that somewhat mechanistically. Why is it then that traditional vets just cannot see this? Because it does have so many studies and science behind it. I don't understand at what point are they not getting it.
I think what's really hard is when we used to do gut biopsies. I was always hesitant, and they actually say don't do it now, luckily. And the results that would come back, we're looking for either cancer or inflammatory bowel disease. And the pathologist didn't have the ability with whatever technology and things they had to tell the difference or be able to help us properly to then help the patient. So I
Right.
think it was probably put in the too hard basket. And I think the power of marketing is unbelievable. I mean, we know this all over the place. Disinfectants, oh, 99% of germs are killed. Makes you want to weep. What about the microbiome? It's needed. It's needed. We've got a microbiome in our lungs, in our bladder, in our brain, in our mouth. And we never knew this before it was a thing a few years ago. And I think the tide will turn. So Tina, don't be frustrated for long. That's why we're here, isn't it? Banging on about it. And we'll keep repeating it until people understand better. And I think your generation will be incredibly lucky, because I think they're going to have far more information about gut microbiome than even now. I mean, it's on a trajectory. We're not there yet to be able to say this specifically does that with many bacteria, but it's already coming. So I think we're on a roll.
I hope
But
so.
yes.
That'd be good. Yeah. I mean, I suppose the challenge from that side of it is then once they understand that this is happening, once some changes are made in terms of maybe where you start with a dog that's got the licky paws or whatever's going on, it's like you suddenly, the challenge for them is going to be, okay, well, then they can notice that wormers would affect them. Then they can notice that the processed food that they're saying to have is going to affect the dog. So it's like, will they ever fully embrace it?
I
Because
think there'll be a part embrace of it, probably. And I think because there are so many fantastic foods out there now, if we can direct mainstream vets to that, that'll be a hell of a start. Can we get them off the wormers and things? I think that's a different topic. I think people are much keener now to do worm egg counts, which is great. But again, the testing's not 100%. And I would argue also from a long time ago, Dr. Penny Watson of Cambridge University was talking about pancreatitis, and she talked about cockers, and it was in the last 30 seconds of the talk. God, it made my ears prick up. She was talking about intestinal parasites in puppies potentially helping the immune system to determine what to do. And because we worm them so much, then perhaps that's why these inflammatory conditions come later in life, because the immune system's not been given that helping hand at the start, or been allowed to do what it should do. She said it's very controversial. I have absolutely no proof, but I'll be working on it. So
well, there is that study. Catherine O'Driscoll used to
great.
teach that. Yeah, there's a study. I mean, this is the only one I can think of offhand. There's probably more, but I'm sure it was in Africa, and they introduced worms to people who were poorly.
Oh,
and
people, we were talking specifically about the cocker, but yes, absolutely. And have you had your gut biome tested to see if you've got that parasite? Is it blastomycostis? I can't remember the name, but I've got it, and I feel very fortunate. I believe about 40% of us have it.
There was a study as well in humans. I think it was on Crohn's disease in humans, and they found that the people that had this specific parasite didn't as often get Crohn's disease as the one who was lacking it, because for some reason this parasite was triggering the immune system to produce more mucus to protect the cell lining, so there was a less chance of leaky gut and these kind of things. So yeah, we kill everything, but we didn't stop to think that some of these are supposed to be there and they're actually helpful.
Yeah. So that's an ancient study, I think was done in the military a very, very long time ago, that showed, and I've often referred to this as a reason not to hoover. I mean, it showed that the dirtier your upbringing, basically, the healthier you were going to be and the less likely you were to develop allergies. So it was looking at parameters like the more pets you had, the poorer your parents were, if you lived in the countryside, if you had lots of siblings, you know, I mean, the more you roll in the mud as a young human, the less likely you are to get ill. So I think we're all saying the same thing, aren't we? It's good to be exposed to things and to develop your immune system accordingly.
And I think it's much harder now, though, Lise, because of the amount of toxins in the air and the water, and even in the soil. I mean, and the soil is so depleted now. So yes, in 100 years ago, I think they were a lot better off. But I worry now that it's just not the same as it used to be. So tricky. I think it's very difficult for parents, particularly living in a big city with children. Really hard. But with these lovely probiotic sprays and stuff and laundry sort of things, I hope that will become much more mainstream. I think it's being talked about a lot more as far as I can work out.
And just have lots of pets in your home. I mean, it's impossible to keep it that clean if you do that.
Well, properly
Win-win.
fed pets. Properly fed pets.
Yeah, absolutely.
I didn't say that I'd talk about this, but it sort of is going to lead on from what we're talking about so much of the microbiome. So if it's okay, last week I performed a fecal microbiome transplant on a kitten, and it's not that commonly done in mainstream practice, but just to give you an example, really, this poor little kitten, since the lady had got it home, had a very dodgy tum, and it would have liquid diarrhea, and it would just leak out all over the place, and it would be going around her house just with feces everywhere. And she had young children, and she was persevering, trying this, that, and the other, and she was on the verge of putting it to sleep because she said, I cannot get this cat right, and I cannot live with it. And I completely understood. She was a very compassionate lady. So we've talked about this, and we've gone through all the process of getting a raw fed cat feces tested, and we did that 2 days ago. So I'll be interested to see how that goes. But I wanted people to know that that is certainly something that is incredibly simple to do, really non-invasive. It's just making a slurry of healthy feces and doing a reverse enema on a dog or a cat. I've done quite a few on dogs, but not one on a cat before. Cats generally have to have a little sedative because they're a bit more lively on the whole, and a bit less keen on sitting still for these sorts of things. But yeah, it's working with nature, isn't it? And that's what we're hoping to do, because I don't know about you, but I'm certainly not as smart as nature.
That's the thing. And we tend to be so arrogant that we think that we can do things better. And I think that's where we go wrong in so many different areas.
And if someone is not following that right now, why are we talking about probiotics and microbiome when we're talking about leaky gut? A lot of people use these terms interchangeably, leaky gut, dysbiosis, because a lot of these imbalances as well can lead to a leaky gut. And anything that insults the gut microbiome can lead to a leaky gut. So things like antibiotics, possibly even antiparasitics, ultra-processed foods, even healthy foods full of glyphosate. There are so many things that can affect the microbiome in a negative way and can cause a dysbiosis. And I think this is impossible for people to remember as well, because I do have, patients and dogs that are on actually very healthy foods, but every month they're getting a wormer or a flea and tick prevention, and they still manage to develop allergies, even though everything around is perfect. So there are a lot of things that can contribute to it, and I think that's important to remember as well.
And even in the drinking water, Tina, I would suggest for some pets, depending on where they live, the water can be full of all sorts of dreadful things. And even if it's filtered, then it doesn't have the minerals that you really want. So I think Caroline's the expert on water. It's incredibly important to get it right for our pets as well as ourselves.
I think, I mean, I've got quite into understanding. I mean, when we're talking about food, we remember that rock-based minerals aren't very bioavailable. And yet when we're talking about water, we often forget that. And I would wager really that it might be better for us not to be looking to get minerals, rock-based minerals from water. Are we actually going to absorb them? I'm not sure that we would do. I mean, the further I get in water, the more I go down these rabbit holes. But I'm beginning to wonder whether actually the mineral content, just how pivotal it is that they get the mineral content from bone. It's becoming more and more pivotal.
But I do wonder if those... Do we think the minerals in the water are affecting the actual water content and quality itself? Because of course there's this electricity, isn't there, with all the sort of different polars. the different electrons whizzing round. And I mean, it sounds a bit woo-woo to say this, but it honestly is something we don't know about. So I think we have to just keep an eye on those things probably. And I'm sure the data will come out.
Certainly, if it's a higher natural salt quality in the water, it holds its framework. It does hold that.
That's kind of what I'm saying.
Life force flow for longer, for sure. Yeah.
Because Gerard Pollock, Professor Gerard Pollock has written such a good book, hasn't he? The Fourth Phase of Water. I love that book, and it's quite astonishing, really. And you know, you'd expect it to be some hippie in a cave writing it, but actually, he's a very, very well-known professor and highly regarded. And therefore, it just opens your mind to the sort of things that we really don't know about yet. And there's a lot to learn, and we'll never learn it all. We know this.
And then, so Bella, when we're talking about leaky gut, what are your approaches to fix it or to prevent?
So just going back to the budget belief in lifestyles, we have to start there. If in an ideal world, so we'll go for the highest end that we can. I will say to people, please don't feed any more grains. Just stop right there. And by the way, rice is a grain. I will ask people to try and take all the ultra processed food out. Because if you look at the description of ultra-processed food in the human terminology, and then you look at the European pet food industry's explanation of how kibble is made, this is the heat-dried kibble, or heat-processed, I should say, I beg your pardon. There are very big similarities. So I would say really, the fact it is also dry bothers me, because water is a metabolite and it's part of the digestive process and incredibly important to keep a healthy biofilm and healthy gut in general, and stop that inflammatory process. So we're going to try and take out all that ultra processing. The other thing people need to know is on the ingredients list, the manufacturers don't have to put all the ingredients in there that they've used. It's a bit like ready meals. They don't have to put absolutely everything they've used in that on the package. So it's being aware that that's the case. And if your pet is suffering from an allergy or some chronic thing, or even some acute situation, let's take that ultra processed part out. And I'll also send them a questionnaire if they're having a specific nutrition consultation, because I want to know a lot more detail about their problem. So are they, you know, with some people, I'll ask them how many times they pass feces in a day. Oh yeah, he's a good doer. He'll pass 6 a day, and we'll go, oh dear. That's costing a fortune, I'll say that to them, because it's just coming straight back out. And then we'll have a bit of a laugh about it, and hopefully sort out a better issue for them, a bit of food that will stop that, and hopefully only have 2 or 3 poos well formed. I want to know detail. I like photos.
That's what being a vet is. You spend your day talking about poos to say, have you got pictures?
It's glamorous as hell, honestly. But I also want to know what sort of temperament they've got. Are they shy? Are they aggressive? Are they reactive? Are they calm? I want to know how much activity they have. I think we're hopefully going to talk about stress in dogs and how it affects the gut. We'll do that in a bit. But I'll also want to know what treats and chews they have, because there are often, if you don't ask the question, you won't get the answer, the data you're looking for, the information you're looking for, which could make or break the treatment that you suggest. So I'll always say, what treats and training treats and chews do you give them? I often get answers like Dentastix, and then I'll say, how long does it take to chew it? About 2 seconds if it's a Labrador. So I said, well, that's a food item, not a chew then, isn't it? So we'll talk about what to do about cleaning the teeth. And I'll ask about the general sort of health with the skin, because that's very important to know. Ear disease is a really common thing. And if I've gone through the history and seen loads of ear disease, anal gland disease, chewing pores, I just know that they've got a leaky gut. It's a funny old thing. It's a syndrome, and you can't do a specific test in veterinary medicine, at least, to say they've got it. But all these little indicators. And you were saying, I think, Caroline, that people often think their pet's really, really healthy until they're not. But in my job, I have to pick up on little things, and this questionnaire really helps with that. So are the nails brittle? Are they have they got clean teeth? That is really important. If they're fighting infection all the time, it'll tell me what they're being fed. Those teeth, if they're covered in tartar, they're not on a good food. That food is very processed and sticking to the teeth like glue, and that's obviously very detrimental. So after the ultra processing and making sure it's a wet food and no grains, those are the first sort of three things I talk about. I'll also then talk about the actual ingredients themselves, as far as, are they feeding chicken or beef or rabbit? Because there are certain animals that are bred intensively or farmed intensively, and they feed them a lot of grain. They have a lot of medication and a lot of vaccines. And I do, like microplastics, I think these things come through in the food chain. And with the sensitive dogs, or even if they're not sensitive right away, I think it does probably affect them. Quite apart from the welfare of those animals, that's a whole different topic. But I think chicken is a no-no for me these days. Back in the day, we said chicken and rice when they had a funny tummy. I would get lots of people saying, oh, the dog wouldn't eat the rice. Well done them.
Good.
And I think the chicken 20 years ago probably wasn't quite as bad as it is now. So again, I say fish and potato these days, preferably sweet potato, just to settle the stomach. And depending on what the problem is, depends on whether we just do those changes or whether they're so severe that we have to narrow the ingredients before we can then start to get them on a more diverse diet. And that people do struggle with, well, I feel he's getting bored, or this, that, and the other. And then I just explain again, if they've got leaky gut, it needs to repair, and it needs to repair really well before it can cope with anything new. And then once those tight junctions are back on board, and those long surface area projections called the villi are nice and long for the proper absorption of nutrients, then we can start to add things back in. But it is a process, and with the severe patients, it does take a few months, and there can be bumps in the road, but that's okay, because they might snarf something really naughty from the hedgerow. You never know. And I say to people to expect that. And we go with supplements as well. So that's another approach. I'm very, very keen on pancreatic enzymes as a supplement, because I think the pancreas is very close to the gut and gets inflamed within an inch of its life if it's got leaky gut. And it doesn't work as well as it used to. So we just use it for a period of time. And it also helps break down the foods that are coming their way to that very inflamed gut, to help it across the barrier before it's actually got into a state where it can't be broken down properly and contributes to the problem of leaky gut being ongoing.
I'm
Yeah.
aware we haven't done any questions yet, and I think one of the questions that we've got really relates to the leaky gut. Should
Yeah,
we?
yeah, it's on here.
should we-
I just wanted to add as well, I do a lot of this, I call an elimination diet. Almost everyone that comes in with, itchy paws, ears, all these things, almost always approach for a fresh food elimination diet. I do want to mention that I have a free PDF on my website, purple.vet, if anyone wants it as well, because it is so handy. I give it out every day, and it's helping so many. And I totally agree on the digestive enzymes as well. It's actually funny how you think about like how a dog or any canine are supposed to eat. They're eating content, raw contents of real animals. They're getting enzymes from what they're eating. But now enzymes are very heat unstable. So as soon as they're heated, they're gone. All the enzymes are gone. So basically everything that the dog normally eats is enzymatically dead. They get no help from anywhere. So that's yeah, I think that's a huge thing to add to a canine diet as well, is to digestive enzymes. It was very helpful. There was a question here in the chat. We do have quite a lot of questions, but let me not lose this one. Aimir was asking because she has an indoor cat, 2 years old, adopted last year, suffered from diarrhea since a kitten. The vets couldn't help or fix it. So when I adopted him, 2 weeks, he no longer suffered from diarrhea, as I gave him fresh food and only S. Boulardi, and has perfect poops ever since. But now, a couple months ago, he started excessively licking and scratching. Not sure if seasonal, so would like to know if I can help him, as I don't want to give him continuous steroids. He's not as stressed as he's a happy cat, not very interested in toys. So not sure if allergies, OCD, over-grooming, or so on. He's a Scottish fold, so they have degenerative joint disease, but he doesn't seem to show any signs of pain as of yet, and he runs around the place.
A
That's what I want.
Scottish fold. Oh my goodness. Oh, I
Did
need
it-
a photo.
Do we know how old he is?
How lovely.
2 years old.
He's not very old, is he, Bella?
No, well, first of all, that was very kind of that person to take that cat on as a rescue. So I think good on them for doing that, because the Scottish fold, yes, it has the mutant genes, unfortunately, but also well done for doing the fresh food. I think that's wonderful. And Saccharomyces boulardii, the yeast probiotic, fantastic as well. So obviously she's done great things there. Being an indoor cat, I think it does depend on the environment. Often with cat owners, particularly indoor cat owners, I will always ask them if they've got any plug-in air fresheners. I'm imagining not for this owner, but I don't know. Any sort of plug-in anything, just don't, because if you watch the Michael Molesley documentary many years ago, he said they put formaldehyde in the air, and I don't know about you, I don't want to be breathing that in. It's not good for us. It might smell lovely, much better plants. I'm now loving your, is it sweet peas at the back there, Caroline, or something?
Oh, what they are. They were from the supermarket. I don't know.
They're very pretty.
Yeah.
But they breathe much better than I know that plastic bowls are not great for cats, just generally to upset the system. So I'm a bit of a snob about that. Just go for ceramic or metal, preferably ceramic. Oh, come on, it can't be too expensive. There's a charity shop round the corner, isn't there?
Oh, can I just disagree for 1 second? Because I think ceramic is just as likely to have toxicity in it. What I would always say, just to make it really simple, is why do you need a pet bowl? Why not just feed your animal from what you're, a plate or a bowl that is actually been approved for human foods? That's what I would say. Because
that could be ceramic though, can't it?
Yes.
No, I'm sure it can, but there are laws about. Yeah, okay. Well, that's the compromise I'm prepared to make.
Thank you, Lise.
But I wouldn't use a ceramic pet bowl that was bought as a pet bowl. I would use something that was, in recent times sold for humans to put food in, because there are rules about what can be contained in those.
They sometimes put formaldehyde actually in those. And one thing to be careful. Yeah, one thing to be careful with ceramics is once they get cracks, they're not very clean anymore because all the bacteria just gathers in that area. So you have to throw it away once you get a little crack. So yeah, metal or glass.
Fusa has a copper bowl now, proper one. It's an old
vintage.
So there we are. That's my bowl snobbery.
I'm
you should really try for gold. But I just think all of those issues about plastic and ceramics and what kind of, but I think if we don't call it a pet bowl, if we feed them from something that we would eat from, then we're past all of that really, really easily. But I think it's a very good point.
Probably glass is the best, actually, when you think about it, isn't it? Because it's widely available and easy to get hold of. After copper, obviously.
Yeah.
Well, thinking about too much copper. Mineral analysis.
It's not. I've looked into all this. The benefits outweigh the potential copper risk, honestly.
Yeah.
The only other thing, I think, going back to the Scottish fold, pain in cats, really hard to tell. I don't know if you've seen the Gary Larson cartoon about the Irish setter's expression for happy, sad, whatever. I think cats are the same with pain, I'm afraid. I don't think you can tell. I think you have to probably do a pain relief trial to know, just for a week, to see if actually they are. I mean, at 2, it seems less likely, especially when they're on a good food. And in regard to the licking and chewing and things, as to whether it's anxiety or parasites or some other thing, or some sort of other pathology, it depends on the distribution on the cat. So is it near the base of the tail? Is it on the underneath, between the back legs? Is it around the head? That gives us a massive clue about what's going on. So we would need to know the distribution of the lesions, as we call them, as to where they're itchy and scratchy.
You know what I would say as well? That indoor cats sometimes really need to ground. They really need to earth. Tina's like, yay! We always think of the same thing at once. So I don't know, Imir, I would maybe think about getting a grounding mat, or something similar, that because it's amazing how they seem to know animals to go. And then if they can discharge some of these excess protons or electrons, or I've forgotten which one it is, up and down, but anyway, one of the ons, if they can discharge them and ground, this may help their cellular communication and detoxification. It's just something worth.
Yeah.
That leads me to an idea of a cat in a harness. I don't know if this cat can be trained. Was that what you were going to say?
Yeah. Because I have
mean,
one. She's in the lead. Yeah.
Awesome. I just love that. And they can just sit on your shoulder, or you can take a sling with you. So if they get scared, they can jump in, but equally they can ground, just like you're saying, Caroline. I think that's such a good idea.
Yeah, I wanted to add, because to be completely honest, just with my clinical experience, I wanted to add that I think majority of allergies I actually see in cats is usually in indoor cats. And just a personal thought as well, I think also the reasons why, dogs get all the diseases that we do, but I feel like cats have a slightly smaller area of problems. And I feel like it has something to do with the amount of cats are being outdoors. They're always getting exercise, they're getting fresh air, they're doing their natural behavior, they get to ground all the time. And I think that's so important for their health. And personally, I think that's the reason why a lot of the indoor cats are seeing a lot more issues than what generally outdoor cats do. Now, not considering all the accidents that happen with outdoor cats, because obviously that's a different story. But when it comes to chronic illness, I find that the indoor cats have more problems with that. And I think it has to do with, no grounding, Wi-Fi, all the flame retardants everywhere, all the air fresheners and toxins in the air. They're not getting to detox the way that sometimes outdoor cats do when they eat what they're supposed to eat. They're grounding, they're being in fresh air. Yeah.
I'm sure that's true, Tina. I'm sure that's true, because all the sprays and the even just the stuff that you might wash your clothes in can affect them, because of course they have absorbent pores and they're walking over everything, and that's tricky, But obviously, again, going back to this nice lady, she's perhaps in a flat somewhere. I've no idea, but if that's the case, then I guess the only thing you can do is try and walk them on a harness in the park. But some cats won't accept that either, and you just do the best you can. And there are loads of probiotic sprays and stuff that you can help them with.
If I can add something, because I do have an indoor cat, and she's outside in the lead every single day, but it takes time with cats. You just need a lot of patience. I think it took her maybe a year, maybe 2 years, full summers, before she was used to the harness. Now she's 7 and she's completely fine with it. But it's really like it takes a long time. You just need to do a little bit every day, just give them time, and maybe in a year or 2 you'll have a cat who's happy being outside in the lead. Or you can have a catio, like some people have. They build a little outdoor area for their cat as well.
Catio. Oh, I love that. That's such a cool name.
But that's generally the thing with cats, isn't it? It's that it goes for changing the diet for a cat as well. It goes for introducing a cat to anything. You just have to be
patient.
Yeah. No, absolutely. I just thought it was my cue to say, if the person who asked the question hasn't read my book, it does talk about psychogenic or behavioral over-grooming versus allergies and things you can do for indoor cats and to improve their health. And also, of course, if we can't answer this question because we can't know, but it would be worth looking at, when did the itchiness start? Did the cat have a vaccine? Did something happen? Was there a stressful situation? Was the owner on holiday? Was there a vaccination? Was anything given? Go on.
She said, I have him trained on a harness and was about to start walking him when he started to get these hot spots, licking and so on. It started around May when I started letting him out in the back garden, so maybe something irritated him outside. What's your thoughts on that?
Well, maybe, but no, I don't know. It's
maybe he was stressed or overwhelmed by the whole experience, or maybe he picked up fleas. I mean, just to be really
depends on the distribution again, doesn't it?
Yeah. Absolutely. I do find, at least for me, if it's not fleas, most likely I see in cats is food intolerances, but maybe that's just my experience. I don't see
But
that
he's got a
environment.
history of something happening where he had improvements by having the Boulardi. There could still be some underlying dysbiosis there.
Agreed. Yeah.
Sure. I mean, what we know from him certainly is that he has a vulnerable immune system. And that's how I think skin and gut really ties together, is that they're very likely to happen in the same individual because their immune system is compromised.
And this is one of those bumps in the road, I would suggest. So just a few tweaks to the diet potentially, and some more supplements might just take him over the line to be healthy again.
I think so too.
Certainly a cat that itches is healthier than a cat with constant diarrhea, so it may be another annoying symptom, but it's a lot less worrying than where you were before. So no doubt it'll get sorted.
And I do want to add as well a bit of predispositions with certain breeds that make it, much more likely to develop an allergy or dysbiosis as well.
Was there another question about behavior and diet?
There was a lot actually. Let me get to them. Okay, so let's start with, so Rebecca had a question. I've been getting a lot of cases at the moment where anxiety appears to be the cause of flare-ups in the gut. I would love to know thoughts on how to support dogs where the cause of poor gut health appear to be more emotional.
Well,
I really find that a really fascinating area, and there's a lot of research being done on it. As we know with stress, you've basically got the production of glucocorticoids, catecholamines, neuroendocrine factors, and those specific things can massively affect the gut. So if there are two things, they can massively affect the gut. So if there's a big stressor, I guess that can then work that way. But equally, if you've got dysbiosis, leaky gut, an unbalanced microbiome, gut microbiome, that can also, there's a huge gut-brain axis that can affect your mind. As I said earlier, leaky gut syndrome in people can cause anxiety, bipolar, schizophrenia, manic depression, all sorts of mental health issues. So there's a huge connection between the two. So which way round was it? I guess we will never know, but what can we do about it is the big thing. And there are a couple of studies. I did write one down just before I came on, a 2011 study in veterinary microbiology saying that the catecholamines of the stress response can affect growth, motility, the biofilm formation, and this is the most fascinating bit, the action of the bugs themselves. So you get pathogenic bugs and you get commensals. Commensals are meant to be the friendly ones, but they can turn. So if the catecholamine has an effect on these bacteria or these commensals, they can actually become pathogens. And I think salmonella was one of them, because unlike what most people think, salmonella is mostly incredibly friendly, only a couple that are not, and they can have a friendly one turn nasty if the catecholamines are attacking them. And that really makes it's so interesting, isn't it? Because if we're mugged on the street, our whole physiology changes, and that's what's happening to these microbiome, these microbes in your gut. So which way around is it? Who knows? But yeah, if they are very anxious, and I think we know that a lot of cockapoos in our practice, at least where I work, can be highly strung. And I obviously tackle the diet first to try and do my checklist of let's try and take out ultra-processed food, make sure it's a wet diet. Also make sure they've got something to chew as well. I'm very keen on raw bones, but I also want to make sure they get the right one and they're not at a risk of choking or getting it stuck somewhere. On the whole, I see, this is a bit of an aside, I see far more problems with non-bone eaters than bone eaters by about, I don't know, 100 to 1 probably, maybe more.
Maybe we should, sorry, I didn't mean to interrupt, but maybe just very quickly, because I think it's a really important point, just elaborate on how you would advise someone who's not used to giving raw bones. What would be your criteria in terms of size and type of bone as a behavioral approach?
Yeah, sure. So I would normally tell people to go to my website and look up my my article on how to do it properly, or Connor Brady's on Dogs First. So he's got a very good guide on feeding raw bones, because it is a protocol. And I mean, if you imagine the size of a Great Dane head compared to a Chihuahua, they got to be different. and also the amount of strength behind the bull mastiff jaw, or the staffy jaw, which is just incredibly strong and crushing, to, let's say, a whippet. So it's really dependent on the breed of dog, and also the setup. So if it's a very multi-dog household, I make it incredibly important that people keep them separate. In a pack situation, even the lowest member of the pack will tell the alpha dog to rack off if it's eating a bone, and that is normal. So you do often get people saying, well, I can take anything away from my dog, and I say, please don't challenge them on it, because there are two things. A, it really might inadvertently show a behavior you're not wanting, and secondly, it makes it very stressed. And we don't want that. We're trying to stop the stress, so it's its own quiet time. We all like a bit of quiet time. That's your pet's quiet time. And eating for 15-20 minutes a few times a week and just gnawing on this bone, which isn't so firm it cracks the teeth, but it's firm enough that it's not going to get splintered and cause a problem, depending on the size of the skull and the jaw strength. So I always talk about that, but that's all. And then when they've sort of finished, they'll walk away, and then they'll just quietly go somewhere else, and you'll quietly remove it without making it a confrontation. And whether you put it in the fridge and save it for another day, or whether you chuck it, depends on the state of the thing. I don't like a small bit of bone left that they could choke on. I do get rid of them at that point, so they won't necessarily eat it all. And I'll give you an example. For my dog, she's a Cocker Spaniel, about 11 kilos. I give her a beef rib. They're just the right size, about this long, about this high, and about that wide. They don't have much on them, so they're not a huge food item to cause a big problem with weight, but they're very satisfying to chew on, and her teeth are immaculate at 2.5. I know she's still very young, but there's not a bit of tartar there at all, and she just loves them. All right. So that's the bone story.
That's, if you've got handouts on your website, that would be really good for people to. I've written some on the Farmer's Dog UK website as well. They sell some really good bones as well, and they also have venison bones. So if people whose dogs are on eliminations can have venison, then there's an option there as well. But yeah, ribs are great, aren't they? Because ribs are usually the right size to start with, because they're too big for the dog to just say, oh, never had one of these before. Down goes the chicken wing. They're kind of like that wrong size for swallowing completely, yet they encourage that kind of stripping action that's, good for the periodontal side of things as well. So yeah, ribs are really awesome, I think. Really.
I think there are different sorts of bones. So there are ingested bones and there are gnawing bones, and the beef rib and the sort of marrow bones are gnawing bones, but you don't want them hungry. I should have mentioned that. You don't want them hungry when they approach these things, because you don't want them going silly on it. And you also get experienced chewers. So experienced bone chewers. So you supervise initially, and then you work out what is sensible and safe and makes them happy before you let them loose and just get on with it. Bernese Mountain Dogs that my sister has, great big knuckle bones, absolutely fine, no problem at all. So it depends on the dogs.
Also as well, some of them, if they're not used to bones, they will go and bury them.
Yes.
And then people say, oh, they didn't want it, and then they sort of throw it away or whatever. But they probably did. They just wanted it to have more bacteria on it.
Yeah.
Later.
I often say to those people, if they did genuinely bury it, I wonder if they're full, and therefore don't feed them that day and just represent it and supervise. But I agree. I think they love a bit of earth on it.
The first time I gave my dog a bone, she ran off with it, and I couldn't find it. And I found it when I was going to bed. It was under my pillow.
Oh, lovely.
Such a lovely.
Doesn't surprise me. Your dog.
A really nice, good, safe place for it.
She's a very sharing kind of a dog.
Yeah.
I think this is a very interesting topic when it comes to mental disorders and the gut microbiome, because obviously being stressed affects our body by excreting hormones that can affect our gastric motility. And as she said, even been studied that can convert non-pathogenic bacteria to pathogenic bacteria that can cause a dysbiosis, and then again can worsen the anxiety. So it kind of goes both ways, right? If you have a dysbiosis, you can have a worse anxiety because of it. So yeah, I think there was some studies as well done, wasn't it, on doing fecal transplants and behavioral issues? think.
Yep. Yeah, and obviously herbs and supplements, and of course exercise. And I don't just mean physical exercise, I mean mental exercise can be transformative, and behavioral changes to help the owner work out what the triggers are and then do better for the environment at home. So it might just be tiny little changes. With cats in particular, small changes can make a massive difference. And if you go on the internationalcatcare.org website, which is one of my favorite, so it's icatcare.org, they have multi-cat households and how to survive them. That's one of their articles. And in indoor cats and how to environmentally enrich the place. And little things like they don't like their water near their food. They like to be fed up high. They feel sick and they want to be in a corner.
Yeah.
That sort of thing is just so, it's such a small thing for us, but it's such a big thing for them. So there's so much that can be done to help with that stress. And then hopefully the colitis will settle down too.
And I just say, I know we're right at the end, but when we have to remember as well, the studies or the data that's being thrown up by Carol at Buying for Pets, where we're seeing a lot of Citrella, a lot of Prevotella, which is becoming much reduced diversity, almost too much of this particular type of bacteria, which predisposes to not coping, not being resilient to emotions, and not being able to feel that contentment. So yeah, there's that to consider that we're going through at the moment, whether that's transitionary, it's affecting humans, it's affecting dogs, it's possibly affecting other creatures as well. So yeah, I mean, a lot of that, the only answers that they seem to have at the moment is the different types of kelp for the different fucoidins that seem to be supporting the bacteria that will overcome the Prevotella. But it's, you know, we are going through that at the moment, and you know, it may
It's
be
very promising, isn't it?
well, to understand it is promising, and whether we can shift it with the FMT, whether we can shift it with the different types of kelp, it seems to be mutating quite quickly. But it makes me wonder whether it is just something we're going through, or whether, you know, that nature will find its own way around it, maybe.
Well, I think FMT is probably my go-to for that sort of thing, but absolutely watching that space because it's fascinating and really helpful. And you've just reminded me, there's the Clostridium hiranois bacteria, which if you don't have that, and I think a lot of dogs and cats with pancreatitis don't have enough of it because they actually break down their secondary bile acid producer.
Yes.
So if you can't break down fat and it's presented in an incorrect form, I really think it causes inflammation to the pancreas and causes a big problem. And we know cats suffer terribly from it. Again, at Cambridge University, they did some postmortems of cats which died from any cause, and they found 75% of them had an inflamed pancreas. Wow. So that's one of the first things that happens. So if in doubt, I would say to my colleagues, give that poor cat in hospital pain relief, because you can't ask them, and I'll bet you the bottom dollar that you need to give that to them. Just something gentle, which would be maybe a gabapentin. I do think it has a place. I don't completely, dismiss anything which I have in practice to use. I find the result is very good, and it's temporary, and it doesn't seem to do a lot of harm to the gut. And I think if you can make it more comfortable, that stress part of the gut goes, because the pain's gone, and we all know what chronic pain is shocking.
Yeah. And then we haven't even talked about the use of antibiotics in dogs and cats and what that does to their microbiome. I mean,
I think we know, don't we?
We are completely out of time. Thank you so much for joining us, and please promise to come back. We will make sure to put Bella's website on the thread under this post. Lovely. And we'll be back next week.
We will be back next week, and we will do the Chihuahua question for the Guardian about the Chihuahua for sure. Okay, thank you so much for watching.
Bye.